Life in the brick kilns has gone on for generations without welfare interventions for the workers. Thus, Goal conceived the Integrated Brick Kilns programme in 2006 and partnered with local NGOs to ensure basic human rights and entitlements for the migrant workers and their children by working closely with the owners, law enforcement agencies and government departments. Goal is committed to addressing the needs of the poorest of the poor and making appropriate, measurable and sustainable improvements in their knowledge, skills, behaviours and quality of life. In 2010, Goal is implementing the Integrated Brick Kilns programme in 35 kilns in the environs of Calcutta with 3 partners. The primary objective of the programme today remains the same as it did at its inception: to ensure that as many workers as possible receive basic education, safe drinking water and sanitation facilities and access to health services.
Earlier, the children would accompany their parents to the brick kilns. This was totally stopped after Goal's intervention. Today, they are going to school on time and their parents are encouraging this. This is a major change from their normal lifestyle.
After 4 years of providing support to the labourers and their families, Goal and its 3 implementing partners, KDS, NMCS and BUP, have managed to build a workable, though sometimes fragile, relationship with the owners of the kilns. Most owners and managers now contribute land, bricks and various materials to assist in Goal's interventions. Over the last 4 years, Goal has constructed several multi-purpose centres, which are providing basic, functional, educational facilities for Sita and many other children, all of whom had never before been to school because of their migratory status. Although they still work extremely hard throughout the day, they now have a few hours of normal childhood to look forward to, where they can learn to read, write, count and play.
Today we have schools, books, drinking water, clean toilets and friends to play with. We are very happy.
The centres also provide the children with safe access to toilets, where they can wash and use the toilets in private. Goal is also working to help enrol children in formal education, and already a number of them have been mainstreamed into government schools.
If it wasn't for Goal, there would be no school and these kids would never be able to learn or play. They have new t-shirts. They are very happy.
Thanks to Goal, the families in the kilns now have access to safe drinking water and are health and hygiene aware, largely as a result of fortnightly health clinic programmes provided for the workers and the children. As a result, they are less vulnerable to vector and waterborne diseases and are treated for conditions related to these illnesses. Goal's continued liaison and dialogue with the Indian government has ensured that families working at the kilns can now avail of ante and postnatal care, institutionalised childbirths, an immunisation programme and the registration of births, the latter of which provides all children born in the kilns with their basic entitlements. Health camps have also diagnosed and provided treatment to children with sexually transmitted infections, which is alarming. Thus, Goal, through its implementing partners, KDS, NMCS and BUP, has been helping children and their families develop systems and measures to protect themselves and their children. 25 child protection groups have been set up, which provide training in basic self-protection. Children and youth are made aware of their rights, including how to minimise putting themselves in risky situations and overall to help ensure their safe development.
If someone calls me after dark, I will not go. But if someone calls me during the day, I will go, but I will not enter the room.
At times this has meant Goal partners intervening to prevent child marriage. Goal is also striving to educate workers so that they enjoy access to fair wages, medical services and other basic entitlements, while making them aware of the importance of legal citizenship, the registration of births and deaths, voter ID cards and below poverty line cards, which qualifies them for government welfare schemes and benefits for the poorest in society. Goal's interventions have made a real difference to the lives of those working at the brick kilns over the past 4 years, and they continue to provide support for the most vulnerable. Over 1 million people currently work at the kilns in West Bengal, and together with other support groups, Goal will provide whatever assistance they can to ensure that ultimately all newborns are registered and immunised, that no child below the age of 14 is working, that all migrant children are protected from abuse and exploitation and have access to formal schooling, and that all brickmakers can avail of health facilities, safe drinking water, hygienic sanitation facilities and improved living conditions. Goal realises that it will be a long road to the desired outcome, but brick by brick we are paving a path to a better tomorrow.